Welcome back to another PT Pearl from the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Dom.
And today we're talking about snapping hip syndrome, something that I hear a lot, especially as a former Pilates instructor. This one got complained about all the time. So we're going to break it down, explain why it happens, and what you can start to do about it. This was one of the number one complaints. Especially think of things like mountain climbers. So when you're on your hands and you're pulling your knees in and out, anything that was basically on the back. So any supine type ab exercise where you're like in tabletop position and then extending the legs out and in, a lot of snapping hips would happen there. And so it's a very popular thing. Anytime I post on social media, it's one of the common questions that I get asked. So we definitely wanted to kind of break it down for you guys today.
Well, yeah, and a lot of people will, I think, be okay with this snapping and popping, at least for a while, or initially they'll be concerned, but then they'll be like, oh, it's not painful, so whatever, I'll just keep doing it. Oh, and I'm getting stronger and I can do more complicated ab exercises, so it's okay, I must be doing it all right. And I think that's one of the challenges we've run into with this snapping hip too. Because I, experienced this a lot, and I was a really high level, athlete in college and stuff. And I think a lot of it is it's not that you're not strong. Mm-hmm. It's a lot of the times it's never that we're not really strong. It has to do more with the coordination and the support and the balance of that strength. And so we're going to dive in a little bit more to that later on. But I think first we want to dice into the next thing we generally hear when we're talking about snapping hip, and we'll hear it referred to as external or internal snapping hip, right?
Yeah. And when we say snapping hip, in case you're not as familiar, just think of that pop sound that it could be. It's usually when the knee is coming up toward the chest or
going back down from flexed forward.
Yep.
Especially if you're laying on your back and you go to sit up really quick and you get a little pop in the front of your hip or something like that. That's generally where you might be like, oh, that's what they're talking about.
Yeah. I mean, you can look in so many different places, right? There's some people that say we have 3 different types of snapping hip syndrome. We have internal, external, and intra-articular.
Yeah.
And really, it doesn't matter, as we don't want to get stuck in the weeds talking and arguing what is correct and what is not. Basically, what we just want to tell you is there's different types, and go over some of the different types that are involved with it. And again, we're not going to be able to diagnose you from this podcast, right? But just giving you an broader view of what it could be, and even some differential diagnoses that could go along with that.
And when we're looking into the research, they said a lot of people would come in and say we're talking about more of an internal snapping hip, or that's what it was described by. First upon the physical examination, they said, oh, you have an internal snapping hip. They said at least 50% of those people, once they dug into it a little more, maybe did some imaging, other testing, would get a different diagnosis, right? And that's where we're going to talk about some of these differential diagnoses, but they would maybe get something like iliopsoas tendinitis, right? And then that, again, is just more so defining the structure that might be involved, might be something that's causing this snapping sound or feeling. And now, it's also irritated and we have this tendinitis.
What could be happening when you're having snapping hip is that we could be having the iliotibial band, which better known by everyone is the IT band.
Yeah.
And this could be snapping on the hip, okay? And then we also have the iliopsoas, which is your hip flexor. So think of the hip flexor muscle. It's actually 2 different muscles, but we'll call it the iliopsoas. That's your main hip flexor, how those muscles kind of act together. And that could be snapping over areas. Not getting too super specific here because, again, it's just in this hip area, we got some bony areas, we got some tendons that kind of rub and can snap in different areas. When we, in our mind, think of, I'm going to activate first from my hip flexor in order to create hip flexion and bring my knee toward my chest, rather than coordinating with all the other lovely muscles and core functions that have to do with it. And that's where your brain says, oh, this tendon is going to turn on, and it snaps over the bone.
So if we're talking different internal diagnoses, that's where we'll go back to, we even did an episode on FAI.
Yeah.
Right? Or our internal structure. And FAI, we're talking that all the way down to the bone, where the bone is getting too much pressure in certain areas and starting to develop these different growths. Or we could look at the different cartilages. You have the chondral cartilage, which is the cartilage that covers the bone, or the articular cartilage. There's just all these different levels and layers within the joint itself that we could be having a little growth on the cartilage because too much pressure. And our body says, oh, we need more cartilage there. And it just starts building. After a long time, if we have too much building, too much growth, that's what causes this long-term diagnosis or long-term dysfunction. But not to say that we can't start to optimize that still.
Yeah. And so what you can still hear like a snapping and a popping deeper inside that joint. So it might not be the IT, it might not be the hip flexor, it might be deeper inside the joint, and it's kind of rubbing on like the labral issues or some of those other structures that Dom.
I don't think I said labral issues, but it is. That's the next level diagnoses that once we look in more, they might define one of those structures as being like, oh, this is why you're getting that.
Exactly. Snapping. So when we're talking about these things that you're feeling, could it be deeper inside the hip? Possibly. Could it be more extra? I think when you start to listen to the whole thing and just start to observe everything we're going to talk into as to the why, then you just start to overall kind of address the entire issue from a broader standpoint.
Totally. Because like we said, I think it was 5 to 10%. That was the number I saw on one study online of people might experience this snapping hip to some degree. But right after that, it says to a large degree of them are asymptomatic. A large number of them are just asymptomatic popping. And that's the only symptom.
Yeah.
And so again, the question becomes, okay, why is that happening? Is it something that might be overuse if I do on a chronic level? And how can we start to approach balancing that differently in our body?
Yeah. If we continue to just say, oh, I have no pain with it, it's fine, I'm just going to let this continue on, I'm just going to get stronger and do more advanced type techniques like Dom was talking about, what could end up happening down the road is we do have these like bursa sacs that kind of almost like cushion what's happening between tendons, ligaments, and the bones. So if we continue to have this snapping back and forth of the tendon over the bone, it could eventually start to irritate the bursa sacs around the hip joint and around those tendon areas, and it could turn into hip bursitis.
And that's the same, with the tendinitis. Like if it is like a different tendon and then we do that over time and then it starts to irritate or become too much, or we get to too high a level, and that's when that tendon starts talking to us. That's when we can develop these tendinitises, tendinoses, and things on down the road. And the message is here kind of like, let's start tuning in, let's start listening to that, and even come back around to like when I do my own core exercises, because I am somebody who, if I would go into like a full pike position or try to do a hollow body, I would get a couple clunks in my hips. And when I go back to the really simple core exercises, like in the optimal body, the core one, the simplest little core exercises, that's when I feel it the most. And you can really feel that deep burn of really finding that anterior support, or the support in the front of your core, the low front of your core, so that you can support those hips in their movement.
Exactly. And it's so funny because it's like, it's the basic stuff, but it's really not.
No, it's hard.
When you start to like program everything and actually go down to relearning how to move within this core, it becomes really difficult.
Well, we were talking beforehand about how as you do it, it becomes more of a motor patterning thing.
Yeah.
And as we do it over time, we just start to develop these motor patterns where it's like, okay, I'm going to lift my hip up. Our body immediately activates and drives through maybe that hip flexor, the iliopsoas, the quad tendon, whatever it is that is just driving that anterior hip pressure. And our body just now has this programmed in that when we raise our hips, that's how we operate.
Exactly.
And it's similar to like, okay, let's go walk through the door and then open it. No, we just need to learn how to coordinate those differently. We don't just need to walk at the door harder and faster.
Exactly. And that's what, it's interesting to have to take a step back and say, okay, it's okay for me to come back to this foundational level, relearn, right? And that's where a lot of the resistance, I think, is, but I can do the super hard ab stuff. I could do total bar. I could do all these things. and having to say, yes, you can. And let's take a step back and just start to relearn some of the foundational basics before we hop through the door again and run face into it. And a lot of times when we're talking about this, and you're thinking, oh, well, if I'm just overusing my psoas, if I'm just overusing my hip flexor, well, then I just need to smash it out. I need to get in there and dig because it's obviously too tight, and that's why it's working on overload, and I need to give my other muscles a chance, so I'm just going to smash into it. And that's where I think that mindset sometimes comes from, of like, it's too tight, let me smash it in, let me dig it in. And that's what, it's actually, if we do turn down the tone of that muscle by applying pressure, which is what we could do.
Totally.
Is that going to really create change in the movement?
Yeah. And even then, when we do use some of these quick fixes or quick releases to gain some of that pliability and understanding of how we can move those hip muscles better, how do we connect it to the movement?
Exactly.
And does smashing anything out make a benefit unless we're kind of learning how to connect it into that coordinated movement? And that's where I really think it's valuable to come around to the breath, because with the breath, we find that proximal stability. And then when we program that in and program that pillar of stability from our rib cage to our pelvis, then when we start to move our hips without compromising that, we can move a little more freely and we allow a little more of that space. So this is where we always come back around to, but some of those basic core exercises, programming that in for a while, and then just starting to do basic arm or leg movements, like just basic heel taps on a chair or something. So you're not even fully extending your leg. You're not even doing anything to that extent, but you're breathing, maintaining that proximal stability, and kicking your legs out.
If we think about what the breath is actually doing, we think, your diaphragm driving how we breathe in and out. But if your diaphragm is moving down and up, what also has to happen is there's going to be different pressures that push down on the pelvic floor, that push out through the back, and that push out through the stomach and around that whole pelvis region where all your muscles and tendons kind of connect into. So then if I'm saying, okay, now if I'm going to start to address the way I breathe with my movement, which by the way, if you're not breathing with movement, you don't actually own that movement owns you. I'll just throw that out there and we'll continue to say that forever, I think. So if I can start to become aware of how my pelvis is working with my diaphragm and my breath, how this intra-abdominal pressure systems are working and how my muscles are coordinating with that, and then I start to use my hip flexor with it, then I start to use my IT band, then I start to pull in all these big levers and big movers with this foundation, that's when I can start to really progress things to a much higher levels in a more efficient and not compensated way.
That's why when you think about core exercises or ab exercises, usually people feel these things during like mountain climbers or bear crawls or things like that. And it's like, so can you assume all of those positions in a stable position with breath?
Yep.
So just get into a plank and work on holding and breathing in a plank for 30 seconds. And if that's difficult, 30 seconds of mountain climbers is a task.
Yeah.
And then if you get good at doing a plank on both legs, get into a plank with just one leg up. Because when we're doing mountain climbers, we have a leg off the ground. Can your body assume a one-legged full body plank for 30 seconds whilst breathing and maintaining that stability and safety? And if that's tough, 30 seconds of mountain climbers might also be tough.
When we talk about this supine or on your back kind of ab exercises, it is like, can you lay down and bend your knees and have your feet flat and then just be lifting one leg at a time? And can you do that without any snapping? Now, can you lift both legs and just tap your feet down with bent legs and without any snapping? Then you would progress to extending the legs. And when we extend the legs, we extend the lever. And so that makes a lot of those muscles around that pelvis and core have to work a lot harder. And sometimes we have to also think the isometrics. So like the holding of something, we should own with the breath as well before we start moving. So you don't have to have these legs go in all these different positions. Like what if instead of just doing mountain climbers, you came and like Dom said with one leg, but you moved it in or you held it in different positions and you breathe with this knee coming toward your chest. Oh, I feel like it's going to pop. So I'm going to hold it right there and breathe and see if I can create something different. Like these, we take for granted the value of holds and breathing rather than we think everything has to be faster and move it more. If you pull it back and you just start holding and breathing, you can, I promise you, feel so much different. And that's why also it's like, I urge people so much, like, get into the optimal body, the challenge is something so that you can start to learn and understand these cues on such a deeper way in the body.
All right, well, there we go. Another PT Pearl on snapping hip and how to explore how you're putting pressures through your hip. I know we have a lot of podcasts that have come out on that. So if we referred to one, you can always go back and check out the other ones on the hip. Or if you have dealt with something that we haven't mentioned, comment below and let us know what you want us to do future PT Pearls on, because we have plenty more to come.